So today I'm really excited to have the opportunity to speak with you about a current project that I'm undertaking with intended parents who've worked with surrogates to build their families in Canada. And I'm going to focus in today on kind of a small piece of the research, which focuses on intended parents' experiences working with surrogacy agencies. So these are businesses that seek to match surrogates and intended parents. And so I launched the study in April 2022. In order to be eligible, intended parents needed to have worked with a surrogate in Canada since 2016. I recruited primarily through social media, mainly through Facebook groups, where surrogates and intended parents go to sometimes to find each other and to get information. But I also recruited through snowball sampling through my participants. And I conducted in-depth semi-structured interviews, typically 75 to 90 minutes over Zoom, and all were conducted between April and June of 2022. And so I asked a variety of questions. I always started off with demographic questions to get a sense of my sample that I was speaking with. I then asked a series of questions about their experiences pursuing surrogacy in Canada. So how they came to work with a surrogate. I asked about the relationship with their surrogate. And I asked about their experience working with the various professionals that they might have worked with as part of their arrangements. So with their agency, with their clinic, their lawyers, counselors they might have encountered, and also their experience at the hospital where their child was born. And I then asked them about their views of Canadian surrogacy laws. So I asked them what they think about Canadian laws, for instance, that make it illegal to pay a surrogate to carry a child. I asked them about provincial laws as well. So the prohibition is a federal law, but provincially we have laws that regulate contracts and parentage. So I asked them about those laws as well. And then I asked them more broadly, what, if anything, you would change about Canadian law and policy if you had the opportunity. And so I conducted 35 interviews, 42 participants, 28 individuals, 7 couples who I interviewed together. 22 were in an opposite sex relationship, 11 in a same-sex relationship. So these are all male couples, and 2 single men, both of whom identified as members of the LGBTQ community. And in terms of the distribution across Canada, the majority of participants were in Ontario, just by chance. Again, I recruited primarily through Facebook. But one of the things that was really notable about this data is that I learned through the study that 20 of my 35 individuals or couples had worked with a surrogate who actually lived in a different province than theirs. So there's a lot of cross-provincial surrogacy happening. And so, for instance, if we look at those 21 intended parents in Ontario, 14 of them actually worked with surrogates in other provinces. So I'd worked with surrogates in British Columbia, Alberta, Saskatchewan, Quebec, Nova Scotia. And so there's a lot of cross-provincial surrogacy happening. And so at this stage, sorry, I skipped a slide. At this stage, I've completed all my interviews and transcription. I'm in the process of writing up my study results. I'm writing the second article to come out of this study. And today I'm going to focus on kind of one observation from the data. And this is that lawmakers and scholars have really worried about power imbalances between surrogates and intended parents. This has really informed the way in which our law has responded to surrogacy in Canada. And I think in some ways, while we should be paying attention to those potential power imbalances, I think some of the attention has been misplaced. I think we haven't been paying enough attention to the various professionals and businesses that stand to profit from these arrangements in Canada. And one example is the surrogacy agencies I'm going to be speaking about in more detail, because some of these agencies' practices are really leaving surrogates and intended parents in vulnerable positions. Okay, so surrogacy agencies. So in April 2024, so the last time I kind of did a survey of what agencies were promoting their services, there were at least 18 surrogacy agencies operating in Canada. And again, these are kind of Canadian-based surrogacy agencies, so not necessarily international surrogacy agencies. These are often run by former or current surrogates. And as I mentioned, their primary function is matching surrogates with intended parents. Some of these agencies offer other services. Some offer to provide, for instance, referrals to lawyers or to clinics. Some of them manage surrogates' appointments at the clinics or provide other kinds of support for surrogates. Another big function that some of the agencies serve is that they help to manage surrogates' expense reimbursements. And so it's illegal in Canada to pay a surrogate, but surrogates may be reimbursed for their out-of-pocket costs or expenses, provided they provide receipts. And so some of these agencies offer to hold money in trust for the intended parents and then to reimburse the surrogates for them, okay? But the real reason why intended parents are working with these agencies, and this is something I confirmed through my interviews, is for the matching services. They said if they were not doing this matching function, they would not be working with them, irrespective of the other potential services they're offering. The other thing that's really notable about these agencies is that what they're doing currently is illegal in Canada. So our federal law criminalizes commercial surrogacy, and one of the things it does is it makes it illegal to pay an agency to arrange for the services of a surrogate, which has been made very clear by the government that means to match surrogates and intended parents. And it's also illegal for the agency to accept payment for that arranging. And the penalties are potentially quite severe under the law, so up to a $500,000 fine, up to 10 years in prison, okay? But in practice, what we know is that the HRA is not being enforced. So there's one agency that was charged with violating the law in 2013, so over a decade ago. They received a $60,000 fine, which I'm going to talk about kind of the agency's fees in a moment. That's really just regarded as the cost of doing business, okay? And so many intended parents currently work with an agency to find the surrogates. And so looking at my sample, 7 of the individuals or couples I interviewed knew their surrogate, so as a friend or family member, but 20 did not. So they met their surrogate either through an agency or online, typically through Facebook, okay? And 25 intended parents had signed up with an agency, 22 ultimately matched through an agency. And the intended parents I spoke with indicated that they had worked with at least 11 agencies. So I didn't ask the names of the agencies. They didn't need to disclose that, but those who did indicated that they worked with 11, okay? And so now I'm going to present a little bit the intended parents' experiences working with these agencies. Just a note that these are all pseudonyms. I'm not using anyone's real names and providing quotes. And so one thing I always want to note is that some of the intended parents I interviewed did have positive experiences working with these agencies. I think the media coverage has been largely negative, where we've seen a little bit of indication about experiences with agencies. So some of my participants were very happy. They matched with a surrogate quickly. They were pleased with the agency support that they provided for them and their surrogates. They found the agency helpful in managing surrogates' expense reimbursements. And so, for instance, Amy was one of these participants. I've heard a lot of horror stories from other agencies, but ours have been great. I haven't had any issues with them at all. It's been an excellent process so far. Okay, but many had extreme concerns or expressed considerable concern about these agencies' practices. And there were 4 main themes that came out of the interviews. They're worried about the fees agencies were charging. They're worried about the matching process. They're worried about how surrogates were being screened, or rather the lack of screening of surrogates entering the programs and how they were being potentially recruited. And they were also worried or concerned about the ways in which they were reimbursing surrogates' expenses. And so with respect to agency fees, I learned through these interviews that these agencies charge on average $10,000 to $20,000 in fees, but sometimes they're over $30,000 to work with them. This is something you can't necessarily obtain this information just by looking online. The agencies are actually quite secretive sometimes about what their fees are. And so many of my participants indicated that they felt taken advantage of by the agencies. They felt these fees were greatly disproportionate to the services that were being provided. Some indicated that their agency only helped with matching. So they offered to provide all these other services, but really didn't provide any of that support for them. And in some instances, they had just charged them that fee, so the $10,000, just to be able to access surrogates' profiles. So it was effectively like getting access to an online dating site. There was no guarantee of a match or any sort of support for that. It was just to access the profiles. And so I heard again and again about the lack of transparency about how these fees are being used. So for instance, Hannah said, like, where is that money going? The agency owners are profiting from the desperation of intended parents, but that money is not going to benefit the surrogate. Like they're pocketing that money, and I don't think the support or whatever they're claiming to give, I don't think the cost kind of covers what they're actually doing. Some intended parents indicated as well that they disliked the matching process. They felt very pressured to make decisions quickly and to transfer large sums of money quickly in order to secure a match. So for instance, transferring $18,000 in 48 hours in order to just get access, okay, to the ability to talk to a surrogate who they would potentially match with. And some agencies, according to the intended parents, were pushing surrogates to act multiple times and quickly. So Grace said, I've heard a lot of surrogates say as soon as they finish a journey, they're like 2 days postpartum, and they're receiving an email being like, when would you like to match again? That's horrific. Like, let the woman rest. If you're sending an email to anyone who's just given birth, the only appropriate email is, how are you doing? Is there anything I can do to support you? Some agencies require surrogates to undergo a psychological assessment and physical screening prior to entering their program. Others do not. And so what this means is that some intended parents pay the full agency fee, so the $20,000 or $30,000. They're matched with a surrogate, and then they discover that their fertility clinic will not actually allow the surrogate to go forward, okay, with IVF treatment. And so at that point, they either get put into another pool of intended parents that are waiting for a potential match and often indicate they're never matched again, because the agency doesn't have a financial incentive to do that for them. They've already collected the full fees, or they're asked to pay rematch fees at that point. And some intended parents indicated they were sent profiles of surrogates whose health or lifestyle choices can make pregnancy dangerous for the surrogate or risky for the fetus. So for instance, Tina pointed out, they wanted to let me know she was very unhealthy. And I'm like, she can't even eat, take care of her own body. She can't take care of herself. Is that somebody you want having a baby, and somebody whose life is probably going to be in jeopardy if she does have a baby because she's obviously not well? And some intended parents spoke about being matched or seeing profiles of surrogates who had recently been in rehab for alcohol abuse or drug use, who were in violent relationships, or who were underage. It's illegal under the HRA to be under the age of 21. And some were matched with surrogates who were younger than that. As well as surrogates who are in potentially difficult financial situations. And I was told that some agencies are intentionally recruiting surrogates by promising they can make money despite the HRA. With respect to surrogates reimbursements, some intended parents were upset or surprised that agencies were using reimbursements effectively to pay surrogates indirectly. And so kind of the going rate currently in Canada is between $2,000 and $3,500 a month in reimbursements. Okay, so it ends up being $35,000, let's say over 10 months. And they're being paid that sometimes irrespective of the receipts provided, or are being told to collect old receipts or fabricate receipts to get up to that amount. Not always, but in some instances. And I heard this again and again from intended parents. Intended parents would then ask for receipts and would consistently be denied by the agency. They would say, I asked for receipts again, and I was told, we'll take care of it. You don't need to worry about it. They would not show us anything. And of course, they're not going to show us anything because you know what? They cut a check to the surrogate first of the month total amount. Some intended parents were upset these payments were happening. They felt lied to or deceived by their agency. Others felt surrogates should be paid. They wanted a change in the law, but they felt this should only be happening if it's legal, and they worried they would face criminal sanctions as a result of breaking the law. And so Isabel, for instance, pointed out, the reasonable part of me says, okay, you didn't do anything wrong. You hired an agency. Yes, they broke some laws on your behalf, but they're responsible. But there's a voice in the back of my head saying, well, holy crap, you just broke the law. Now you could potentially go to jail, or you could be fined $500,000. And so the intended parents were often advised by their lawyers not to ask too many questions. They needed to be on their agency's good side if they wanted to be matched. And they spoke of agencies blacklisting some intended parents. And so I heard of some intended parents being very afraid of these agencies. And so for instance, Rachel pointed out, I know this is going to sound crazy, but I'm still scared of her, the owner of the agency. I know nobody's taking my baby away. Baby's born, everything's good. But I was scared of what she could do to hurt my relationship with my surrogate and therefore my family. And so I can speak about this more in the Q&A, but just in conclusion, I think we need greater regulation and oversight over these agencies from this data. And I have some ideas about ways forward, but again, we'll leave that maybe to the Q&A. Thank you very much.
Thanks very much. All right, so I'm delighted to be here to speak a little bit about our Surrogates Voices project this morning. Our research project is seeking to answer 5 questions. Who are surrogates? What are their socioeconomic characteristics or family characteristics or reproductive histories? What are their motivations? Who works with surrogates over the course of the surrogacy journey? What are surrogates' experiences during and after birth? And finally, how can we improve surrogacy in Canada? So we have, this project is divided into 3 stages. The first stage is the stage that I'll be speaking to you about this morning, the findings from a survey that we conducted, the Exploring Surrogates Experiences and Insights survey. The second stage of the project is a series of interviews. We conducted interviews with 41 surrogates to learn more about these questions. And the final stage is around data collection. It's a review of current data collection practices in Canada. And it really seeks to identify gaps in the national data regarding surrogacy, including demographics, pregnancy rates, birth outcomes. Okay. So just a little shout out to our team. This research project, of course, is the collective effort of many people who are actually in the room today. And so a huge thank you to all of them for all of their work on this project. So today, I'd like to just speak about a sort of a small sampling of some of the findings from the survey in the limited time we've got. I'd like to share some of the findings from our sample, explore some of the participants' responses with respect to their motivations for acting as a surrogate. I'd like to follow up and talk about agencies. So, spoiler alert, there's, much of the comments and things that we've heard from surrogates resonate with some of the findings that Stefanie's made in her study, and then spend a little bit of time talking about surrogates' experiences before and after birth from this survey. All right, so a little bit about methods. So this survey was an online survey. It was conducted in the spring and summer of 2022. After we cleaned up the data, we had 174 responses. The questions were not mandatory, so you may see if you're crunching the numbers on the slide, sometimes they don't always add up. And I, want to stress at the outset here that these findings really shouldn't be taken as representative of surrogates in Canada in general, but they do provide some new insights and information about surrogates' experiences in Canada. All right, so a little bit about this sample. We asked several demographic questions about the participants. Importantly, the information that we were asking about was at the time of the most recent surrogacy, okay? So for example, for age, we didn't ask how old the participant was at the time of the first surrogacy or sort of averaged out over the course of their surrogacies, but rather at their most recent surrogacy. And so you can see on the slide that the majority of our participants were between the ages of 31 and 40. We did have a few participants who were over the age of 41 and a few participants who were between the ages of 21 and 25. Overwhelmingly, our participants identified as female when asked about their gender identity. The responses were more mixed about sexuality. A strong majority identified as straight or heterosexual, but a significant portion identified as bisexual, and several other orientations were represented as well. Again, in terms of the relationship status, a majority of our respondents noted that they were married or in a common law relationship at the time of their most recent surrogacy. And those responses were nearly identical when we asked about their current relationship status. So we do see some consistency across that data. Household income. So we've represented the household income in this slide in quintiles, but it's actually easier to sort of think about this and talk about this in thirds. So if we think about it in thirds, the household income, almost a third of respondents reported having household income of under $50,000. Slightly over a third reported income between $50,000 and $100,000. And the last third reported income of over $100,000. And so this really demonstrates that surrogates who responded to this survey come from many different levels of household income. You know, that's an interesting finding based on sort of what we sometimes assume about who is acting as a surrogate. Okay. Strong majority of our participants, their most recent surrogacy had occurred within the last 5 years. And in terms of the number of times that the participant had engaged in surrogacy, again, we see a majority had only engaged in one surrogacy. Most of our participants, 94% had indicated that their most recent surrogacy was a gestational surrogacy, so they were not using their own egg. And of those participants, 2/3 reported that the egg had come from an egg donor. Location. And so here we start to see some of the data resonating with what Stefanie found in her study. So this wonderful map prepared by Eleanor. Thank you, Eleanor. I love this map. So in bright yellow markers, you can see that this is where surrogates are living at the beginning of their most recent surrogacy. And then the forest green markers are the intended parents. And so it's a great slide to really illustrate, provide a little bit of context in terms of where surrogates are relative to where the babies they bear are going. And so you'll see the majority of our participants reported that they lived in Ontario. We did have others reporting out of Alberta and British Columbia and Quebec. But what I really want to highlight on this slide is where surrogates are vis-a-vis the intended parents that they're working with. So what this map illustrates is that only 40% of surrogates and intended parents were from the same province. In 20% of cases, the surrogates who responded to this survey were working with intended parents in another province, and 40% of our participants reported that they were working with intended parents who lived outside of Canada. So we see that Canada is really a destination for intended parents from other countries. Okay, reasons for surrogacy. So we asked our participants what motivated them to become a surrogate. And there was an opportunity to pick more than one box. You could check more than one box. And so you can see from the slide that 86%, so overwhelming majority, indicated that they were motivated to become a surrogate because they wanted to help other people. In some cases, those participants indicated that they wanted to help a stranger to become parents, and others wanted to help a friend to become parents. Almost half of the participants indicated that they enjoyed the experience of being pregnant. And again, this is something that we heard repeatedly in the interviews that we conducted in the second stage of the project. We asked participants who they worked with over the course of the surrogacy journey. And you'll see that there are a number of different individuals that they worked with. I want to spend some time focusing on the experiences with surrogacy agencies, but of course, important to note that our participants reported working with lawyers, fertility clinics, in many cases were engaged with online support groups, whether on Facebook or other online supports. Many worked with counselors as well, and midwives and doulas. Okay, so let's spend a little bit of time talking about agencies. So the surrogates who responded to the survey, we asked, what role did the agency play during the surrogacy journey? We tend to hear a lot about, thanks, Sarah, about the matching process and the agencies being heavily involved in that matching process. And that is certainly reflected in the data. But we do see that there's a whole host of other roles that the agencies are playing over the course of the surrogacy journey. They're making referrals to a wide range of other professionals, whether they're lawyers or counselors. They're assisting with booking medical appointments, with obtaining life insurance or other forms of insurance. In some cases, they're, mediating the communication with the intended parents. And in a small number of cases, the participants reported that the folks from the agency were actually attending different types of appointments, whether it was the IVF transfer, medical appointments, and sometimes the delivery. We didn't ask our participants whether they had a positive or negative experience with the agency. We did have a spot on the survey where the participants could write some comments. And from those comment sections, there's some very revealing data, I think very helpful in terms of thinking about where law and policy should be focused. And so, again, not representative of surrogates' experiences generally, but some of these comments raise important questions about how or why we should be paying more attention to agencies. So we see on this slide, one participant noting agencies need to have people who give a shit about their surrogates. My agency coerced me into signing an agreement, really concerning comments. A second participant noting that I've seen through the surrogacy agency I worked with for my first surrogacy that there are many people, surrogates and agency staff, that take advantage of intended parents financially during the process. This participant, provided a great suggestion about the need for more government supervision or a nonprofit to help surrogates navigate the surrogacy process. So this participant noting, I would like to see more governing of the agencies. I feel there's a lot of corruption, misinformation, and people being taken advantage of with some of the agencies. A lot of room for education for to the public, doctors, et cetera. Okay, need for a government or nonprofit body that can help potential surrogates navigate the process without us feeling like a product that the agencies are selling to the intended parents. All right, so thanks. In the last 2 minutes I have, I just want to share a few of the findings about the surrogates' experiences before and after birth. Important to note that this survey is certainly impacted by COVID. And so hospital policies around COVID, certainly in terms of who attended the birth, would have had an important impact on these findings. But we can see from the chart that, in roughly 3/4 of our participants reported that the intended parents were present at the birth, and in roughly half of the participants noting that their partner was at the birth. Roughly 1/3 also noted having a midwife at the birth. And again, we've got some really rich, from the interviews, some really rich data around the roles of midwives, doulas, and other support members being present during the birth. In terms of decision-making, so obviously, I don't think I need to tell anyone in this room that a person giving birth should be the only person providing consent about their medical treatment during birth. But we do see some overlap in the responses here. And importantly, about 1/3 of participants indicating that the intended parents were the ones to make decisions during the birth. Again, we had some mixed comments from participants about their experiences, some quite positive, feeling everything went so well postpartum, great experience, start to finish, couldn't have asked for better. But some very concerning comments again, okay? Some of the hospital staff were very rude and made unkind comments. Some noting the need for more support. So having, for example, the second participant noting that having a counselor in the hospital to talk to following birth and my kids being allowed to visit would have made a huge difference. And a third participant noting concerns about misinformation and miscommunications, which led to a poor experience postpartum. And then, you know, an excellent experience at this hospital, you know, again, stressing the excellent communication at the hospital, excellent accommodations for all of the folks who are involved. And finally, I'll end here with the need for more postpartum supports. So again, the surrogates really noting that there needs to be more aftercare, there needs to be more support for surrogates after the baby is born. Thank you very much.
Allô? Oui. Donc, merci d'être là avec nous ce matin. Donc, je vais faire ma présentation en français. Par contre, le PowerPoint est en anglais et je constate que 15 minutes, ça passe excessivement rapidement. Donc, il y a des slides qui vont aller plus rapidement. Donc, je suis contente d'être ici pour vous parler aujourd'hui de l'expérience des enfants de femmes porteuses de la GPA de leur mère, de la grossesse pour autrui de leur mère. Il faut savoir qu'à la chaire de recherche, nous, on s'intéresse beaucoup aux personnes concernées par le don de gamètes ou par la GPA, donc les enfants nés de cette façon-là. Et donc, beaucoup de nos travaux portent spécifiquement sur eux. Donc, qu'est-ce qu'on sait déjà sur les enfants des femmes porteuses? Je vais y aller brièvement. On sait peu de choses parce qu'il y a très peu de recherches qui ont été conduites sur ces enfants-là, dont une par notre collègue ici là, qui va être notre key speaker ce midi. On sait que ces enfants-là présentent des résultats typiques, des scores typiques plutôt aux tests standardisés qui mesurent leur santé psychologique, leur estime de soi, l'expression de comportements externalisés comme des troubles de comportement ou internalisés comme de l'anxiété. On sait aussi que la majorité des enfants vont rapporter avoir vécu une expérience positive en lien avec la GPA de leur mère. Les relations peuvent perdurer dans le temps. C'est ce qui a été démontré aussi là, par l'étude de Jadva et sa collègue. Et certains enfants vont avoir considéré les enfants portés par leur mère comme des demi-frères, demi-sœurs, comme des cousins, même s'ils ne sont pas génétiquement liés l'un à l'autre. Par contre, on sait aussi que les plus jeunes enfants semblent présenter plus d'anxiété ou plus d'expériences mitigées. C'est le cas dans une étude qui a été conduite aux États-Unis par Riddle qui démontre que sur les 13 enfants, une très petite étude qu'elle a interrogée, les 13 enfants, 5 ont vécu des émotions négatives pendant le processus et 3 ont trouvé difficile la remise de l'enfant à ses parents d'intention. Et ce qui est important de noter, c'est que souvent, les mères évaluent plus positivement l'expérience de leur enfant que leur enfant l'évalue lui-même. Donc, ces recherches-là sont très intéressantes, mais elles présentent certaines limites pour bien comprendre l'expérience des enfants, notamment plusieurs d'entre elles, c'est des petits échantillons et d'autres, c'est des devis mixtes qui laissent peu d'espace, si on veut, à la voix des enfants. Donc, c'est ce qu'on a voulu savoir, là, de mieux comprendre les perceptions que les enfants ont du processus de GPA là, dans lequel leur mère s'est engagée. Donc, j'y vais brièvement pour la méthodologie. On a recruté ces jeunes-là entre avril 21 et février 2022. Les critères d'inclusion étaient d'être âgés de plus de 5 ans, d'avoir les souvenirs d'au moins une GPA et d'habiter évidemment au Canada. Et ce qu'on a fait comme procédure de collecte de données, c'est qu'on a utilisé le photo voice comme stratégie de détaillage, donc pour dégêner l'enfant face à nous, si on veut. Et ensuite, on a utilisé une entrevue semi-structurée qui était encadrée autour de 4 thèmes principaux. Un, la compréhension qu'ils avaient, ces enfants-là, de la GPA de leur mère, leur expérience qui entourait le processus de GPA, la façon dont ils ont vécu la remise du bébé à ses parents et les représentations qu'ils ont de l'enfant né par GPA. Aujourd'hui, on va voir juste les thèmes 2 et 3 parce que 15 minutes, ça passe vite. Donc, cette fameuse carte du Canada que Éléonore a fait en premier et que tout le monde en a adapté par la suite, voilà, on voit d'où les enfants viennent, principalement du Québec et de l'Ontario. On constate aussi, on a rencontré en fait 62 enfants, juste pour dire, 62 enfants de 34 familles, donc 34 mères qui ont fait 61 GPA. OK? Et on constate là, ce qui résonne avec Surrogate Voices, c'est qu'on a quand même un nombre non négligeable de GPA qui proviennent de l'international. 26 viennent de l'international, 26 ont été au Canada et on manque d'informations pour 9 de ces GPA-là. Et il y avait 8 GPA génétiques, les autres, c'était des GPA gestationnels. Donc, ici, on voit le statut marital des mères. La plupart étaient en union de fait avec le père ou l'autre parent de l'enfant ou mariés. Mais ce qui est intéressant, c'est qu'on s'aperçoit qu'à peu près la moitié de l'échantillon, 49 a en bas de 10 ans et l'autre, 47 en bas de 10 ans et l'autre moitié, c'est des adolescents. On a eu quelques jeunes adultes, là, 6 jeunes adultes. Le plus vieux avait 27 ans. On a rencontré 27 garçons, 34 filles et un jeune non-binaire. Donc, au moment de l'annonce de la grossesse pour autrui, l'émotion principalement ressentie, waouh, c'est pas clair comme ça. Bon. L'émotion principalement ressentie, c'est de la joie, de l'excitation. Et ce qu'on constate pour les jeunes qui ont rapporté de la joie et de l'excitation, c'est que leur mère les avait préparés en amont, c'est-à-dire qu'elle leur avait dit « J'aimerais ça être une femme porteuse, ça veut dire ça, être femme porteuse, c'est pour cette raison-là que je vais être femme porteuse. » Si elle connaissait les parents, elle leur montrait des photos, « Voici les parents et voici pourquoi ils ont besoin de moi pour avoir un enfant. » Ce qui fait que les enfants étaient déjà, comment je pourrais dire, concernés, étaient déjà à l'affût que le projet allait venir. Plusieurs mères ont demandé la permission de leur enfant avant aussi pour savoir si l'enfant était d'accord. Néanmoins, ça ne veut pas dire que tout le monde a réagi positivement. On a ici, par exemple, Evan qui a ressenti plutôt de la colère parce qu'elle s'est sentie bousculée, c'est-à-dire que sa mère lui en a parlé en amont une fois. J'aimerais ça être mère porteuse. Par la suite, le projet s'est réalisé, donc elle l'a appris au moment de la grossesse qu'elle n'a pas aimé. Il y a d'autres jeunes aussi qui ont dit avoir ressenti de la confusion, de la surprise, parce qu'en fait, ils ne comprenaient pas comment ça pouvait se passer. Ça, c'est les enfants dont les mères les avaient très peu informés à l'avance. Beaucoup se sont demandé comment l'enfant est rentré dans le ventre de maman. Est-ce que maman a pu avoir, par exemple, des relations sexuelles avec le papa, le parent d'intention? Donc, il y a beaucoup d'enfants qui se sont questionnés là-dessus. Comment ça se peut, ça, que maman soit enceinte d'un enfant qui n'est pas lié à elle? Et à partir du moment où la mère a expliqué le projet, les enfants disent « Ah, ben ma surprise s'est transposée en joie par la suite. » Pour l'expérience de la grossesse, la grande majorité des jeunes ont dit que la grossesse n'a pas changé du tout leur quotidien. Ils vont faire état de beaucoup d'implications de la part de leurs autres parents, beaux-parents, grands-parents qui vont venir aider et soutenir la grossesse. Il y a, comme ici, on a Jules là, qui raconte que son beau-père a été très impliqué pour aider la mère pendant la grossesse. Il y a quelques éléments qui ont été mentionnés par les enfants comme étant inquiétants, c'est-à-dire quand la mère était alitée pour des enjeux de santé, beaucoup d'enfants se sont inquiétés à savoir est-ce qu'il allait arriver quelque chose de grave à maman. Beaucoup d'enfants se sont inquiétés de ça. Et plusieurs nous ont mentionné avoir été obligés de faire des tâches supplémentaires à la maison pour soutenir leur mère, principalement celles dont les mères étaient alitées. Plusieurs ont trouvé ça difficile d'avoir aidé leur mère, quoique d'autres ont plutôt dit, comme Elias, qu'ils étaient fiers de pouvoir participer au projet de GPA en aidant maman avec les tâches à la maison. La majorité des jeunes nous ont raconté l'accouchement en détail, en donnant beaucoup de détails sur comment ça s'est passé, mais d'autres ont vécu ça de façon plutôt indifférente, particulièrement les garçons là, qui semblaient moins intéressés par la question de l'accouchement, même s'il y a certains d'entre eux qui en ont parlé avec enthousiasme et fierté. Et en général, les jeunes ont raconté avoir vécu beaucoup d'excitation au moment de l'accouchement. Ils avaient hâte de voir le bébé, ils avaient hâte de voir la joie dans le visage des parents. Il y a 6 adolescentes qui ont été présentes au moment de l'accouchement. Il y a 5 qui auraient aimé être là aussi. Ces 5-là se sont montrées beaucoup déçues de ne pas avoir pu participer à l'accouchement, mais celles qui sont allées ont décrit un moment excessivement transcendant et très positif, là, comme on peut le voir ici avec Lila. Il y a des difficultés, par exemple, 9 jeunes ont mentionné des difficultés en lien avec l'accouchement. Comme ces jeunes-là ne savaient pas comment l'accouchement allait se dérouler, ils sont partis à l'école le matin, ils sont revenus à l'après-midi. Maman était partie à l'hôpital avec l'autre parent, les grands-parents étaient à la maison pour garder, ou encore ils se sont levés le matin, maman était partie à l'hôpital. Il n'y avait pas d'informations sur comment ça allait se passer. Ils textaient maman, évidemment, maman ne répondait pas. Et donc, ils se sont montrés assez anxieux de la situation. 2 jeunes ont eu des mères qui ont eu des difficultés au moment de l'accouchement. Une avec un placenta prévia et l'autre qui a eu une césarienne. Et dans ce cas-là, quand la mère, après la césarienne, où elle a eu une hémorragie importante, elle est restée à l'hôpital pendant 2 semaines. Quand 6 mois plus tard, elle a dit à son fils qu'elle voulait être femme porteuse à nouveau, son fils a ressenti de la colère et lui a dit qu'il n'était pas vraiment d'accord avec l'idée qu'elle recommence ce projet-là dans un contexte où ça avait été difficile pour elle la fois préalable. Tous les jeunes, à l'exception d'un d'entre eux, disent avoir été préparés au fait que l'enfant ne vivrait pas avec eux là, suite à sa naissance, même si 10 ont dit qu'ils ne comprenaient pas vraiment qu'est-ce que ça voulait dire avant. C'est après qu'ils se sont rendus compte qu'est-ce que ça voulait dire vraiment, là, que le bébé partait plutôt loin. Lorsqu'on observe les émotions vécues par les enfants lors de la remise de l'enfant aux parents d'intention, on constate que la majorité des jeunes, 55 vont exprimer de la joie, de la satisfaction quant à l'ensemble du processus. D'autres vont dire avoir créé des liens avec la nouvelle famille. 19 ont fait part d'un sentiment de tristesse et 19 aussi ont fait part plutôt d'émotions ambivalentes là, en lien avec la remise de l'enfant. On imagine souvent que la remise de l'enfant, c'est quelque chose, comment je pourrais dire, que la séparation avec l'enfant, c'est un moment type. On arrive à l'hôpital, puis ensuite on part, mais c'est pas comme ça que ça se passe en fait, puisque comme Vanessa l'a démontré, les femmes porteuses puis les parents d'intention habitent pas un à côté de l'autre. Même si c'est canadien, si on a des parents au Québec, la femme porteuse en Alberta, il faut voyager pour aller rejoindre les parents. Donc, ce qui arrive, c'est que les parents vont à côté de la femme porteuse dans sa proximité géographique pendant quelques semaines avant l'accouchement et reste quelques semaines après l'accouchement pour régulariser la situation de l'enfant, notamment son passeport, son certificat de naissance. Pendant ces semaines-là, les parents d'intention sont très impliqués auprès de la famille de la femme porteuse, principalement ses enfants. Avant l'accouchement, ils vont l'amener au parc. Ils vont faire des activités avec les enfants pour laisser la femme se reposer. Donc, les enfants développent un lien avec les parents et c'est pour ça qu'ils ont de la peine quand les parents quittent. En fait, ils ne parlent pas du bébé, ils parlent des parents. C'est aux parents qui se sont principalement attachés. Rapidement, la grande majorité d'entre eux, sur les 61 enfants qui sont nés de la GPA, nos participants ont maintenu des contacts avec 51 de ces enfants-là. Différentes méthodes de communication, par exemple par WhatsApp, Messenger, des vidéos, FaceTime et tout ça. Quand il y a des groupes privés, c'est intéressant sur WhatsApp ou Messenger, les enfants des femmes porteuses sont inclus dans ce groupe-là, donc ils peuvent interagir. Par contre, il y a 10 qui ont perdu contact avec les enfants, 10 enfants avec qui il n'y a plus de contact par la suite et nos participants se sont montrés très, très critiques de ça. Ce qu'ils disent, c'est que leur mère a été instrumentalisée, a été utilisée par des parents qui leur ont promis des choses qu'ils n'ont pas réalisées par la suite et qui se sont évaporés, avec qui on a perdu de contact. Alors, les enfants vivent ça assez difficilement. Ils sont critiques de cette situation-là. Donc, j'arrive au bout. Alors, qu'est-ce que ces résultats-là nous apprennent? D'une part, on constate que l'expérience des enfants, ce n'est pas une expérience qui est unidimensionnelle. C'est une expérience qui est globalement positive, mais il y a des événements, des situations qui sont vécues plus difficilement. C'est notamment le cas lorsque les enfants n'ont pas toutes les informations sur ce qui va se passer ou sur ce qui pourrait se passer suite à l'accouchement. Les adultes, on a souvent tendance, dans une vision adulto-centrée, de protéger les enfants en leur donnant pas d'informations. « Oh, inquiète-toi pas, tout va bien aller. » Quand les enfants entendent leur mère dire qu'elle a un placenta prévia, les enfants s'en inquiètent. Qu'est-ce que ça veut dire? ça veut rien dire, inquiète-toi pas avec ça. Mais en réaction, les enfants, c'est pas vrai qu'ils s'en inquiètent pas, c'est qu'ils s'imaginent des scénarios et ces scénarios-là sont toujours pires que ce qu'on voit dans la réalité. D'où l'importance de donner l'information comme elle est. Quand on regarde l'expérience globale des enfants, on s'aperçoit là, que même ceux qui ont rapporté des difficultés là, vont quand même parler d'un processus qui est globalement positif. Les difficultés sont circonscrites dans le temps et ça n'atteint pas l'ensemble du discours pour tout le processus. Ça, c'est important de noter ça. Plusieurs des jeunes ont dit avoir ressenti de la fierté à l'égard de leur mère, sont contents de voir qu'elle a permis de créer une nouvelle famille et vont parler de ces parents-là comme étant des personnes maintenant significatives pour eux avec qui ils ou elles développent des liens. Et c'est vrai, certains d'entre eux vont, au moment de la rencontre, ont planifié des voyages pour aller visiter les parents d'intention. Dans 2 situations, les parents d'intention ont même payé le voyage aux États-Unis et un en Europe à un des enfants qu'on avait rencontré où il avait passé l'été avec les parents d'intention d'un enfant qui était né là, des années préalablement. Donc, quand on parle de la relation, quand on parle de la GPA, généralement, on va circonscrire la relation entre les femmes porteuses, les parents d'intention et l'enfant qui est né de ce processus-là. Et on exclut les autres personnes qui sont autour, principalement les familles des femmes porteuses, leurs partenaires de vie et leurs enfants. Or, c'est important d'en tenir compte parce que ces enfants-là ne sont pas des témoins passifs de la grossesse de leur mère, mais sont des acteurs actifs engagés dans le processus et donc qui peuvent subir les contre-coups d'un projet de GPA, que ce soit positivement ou non. Donc, voilà, je pense qu'on a fait... ouais, c'est bon. Merci. Juste un petit mot avant de passer à Ali. Nous, on développe beaucoup d'outils de diffusion des résultats pour les personnes qui participent à nos projets, incluant les enfants nés par GPA. Donc, on a conduit un comité d'experts de diffusion des résultats composé de jeunes entre 5 et 10 ans. Et on a développé avec eux des TikTok qui permettent de leur redonner les résultats de recherche. C'est eux qui ont choisi qu'est-ce qu'ils avaient envie de donner comme résultats de recherche. Et on a produit 6-7 en français et en anglais. Si jamais ça vous intéresse, ils sont disponibles sur nos réseaux.
All right. Hi, everyone. So my name is Alicia Czarnwoski, and I am here to talk to you today about my doctorate research. So I'm conducting a study called Understanding the Role of Canadian Surrogacy Consultants. And this is the first qualitative study interviews done with Canadian surrogacy consultants. So before I launch into what I'm doing, I'll just give you a little note on language. So I'm using the term consultant to mean a representative of a for-profit business that's matching intended parents with surrogates. You might hear other language used for this, like Vanessa and Steph were using the term agency. Some other people use the term broker. I chose the term consultants and consultancies just because that's what my participants seem to prefer. And sometimes I will also use the term intermediary, and that's just coming from language that's rooted in the Assisted Human Reproduction Act, the AHRA. So my interviews, the goal is really to tap into new voices that haven't been heard from before. And I'm using feminist relational theory to really analyze 2 main questions. And the first thing that I want to understand from my interviews is sort of how are the current laws actually functioning? So as Steph had mentioned, we have this act, the AHRA, that prohibits arranging surrogacies. And Health Canada has come out and clarified that that means that you can't pay someone to match a surrogate with an intended parent. And at the time that the law was put in place, lawmakers were really doing this to try to prevent surrogates from being exploited. They didn't really like surrogacy at that time. They had quite negative views. And so they wanted to stop surrogacy as much as they could, especially commercial surrogacy, in order to protect the surrogates. But again, despite these prohibitions, these surrogacy consultancies are still operating openly across Canada. So this law is not being actively enforced. So because of this, I want to know, how are these laws actually working? How do the consultants understand them? Are they actually curtailing any harmful activities? And in some instances, could they potentially be preventing any beneficial activities from taking place? The second thing that I want to understand is, how are these practices that are reported by these consultants impacting the surrogates and the intended parents? And so when I'm analyzing this question, it's really important to keep in mind that I'm not getting, firsthand information from the surrogates and from the intended parents like Vanessa and Steph. But, I'm doing my research in conjunction with their research. So, it's just part of kind of getting that whole picture of how are all these players working together in this field. So the sample. I mostly used internet searches to find my participants, but there was also a bit of snowball sampling. So back in March of 2021, I conducted a bunch of different Google searches. So I was looking up things like surrogacy agencies in Ontario, surrogacy broker Canada, help me find a surrogate Canada, match me with a surrogate British Columbia, like any kind of combination of words that I could think of. And I did these searches again 6 months later in September, or roughly 6 months later. And ultimately at that time, I identified 12 eligible consultancies. There have since been more that have opened up. But at that time, you needed to somehow say that you were located in Canada exclusively, so didn't have offices also in the States, and that you were facilitating the matching between surrogates and intended parents. So I began recruitment in October of 2021. I sent emails to each of these consultancies, and my hope was to employ census sampling. So I wanted to speak to a representative from each one of these consultancies. Ultimately, I wasn't able to do that, but I did get to speak to 8 out of the 12. So 2/3 was still definitely more than enough to meaningfully engage with all of my research questions. And so I completed my interviews in October and November of 2021. They usually took about, an hour to an hour and a half. And I was using a semi-structured interview guide that got lots of thoughtful input from my committee, who's here today. And also I had spoken to 2 surrogates beforehand just to hear about their experiences. And that really helped me shape my interview guide as well. And I added some specific probes in there just based off of what I was hearing from them. So the way the interview guide was structured is I asked them some warm-up questions like, how did you become involved in surrogacy? Sort of meant to build rapport, ease them in. And then after that, I structured my questions in chronological order. So, what was your role before conception, during pregnancy, during birth, and then postpartum? So examples of what I would say was something like, walk me through what you do for your clients before conception occurs. Or, what do you do for your clients during pregnancy? And I explained that when I said clients, I meant both the surrogates and the intended parents. So these were very broadly phrased. And then I did have specific probes where if the consultant didn't raise something themselves, I would ask about it later. So for example, if they didn't talk about screening, I would say, can you tell me about any screening that you did on surrogates or on intended parents? After walking through it chronologically, I then asked some of the tougher questions. So I asked how they were paid for their services. I asked about the benefits and the challenges of their practice. And I asked about their opinions on the law. So again, I saved these sort of for last so that hopefully the trust and rapport that we had built throughout the interview could come in handy there. And examples of how I phrase these questions are, how much do you charge intended parents for your services? Can you tell me a bit about the law and how it impacts your work? And some people suggest that what consultancies are doing is inconsistent with the AHRA. What would you respond to them? And then I had a couple last minute wrap up questions. So that's how it was structured. As I progressed through my interviews, I did massage the interview guide a little bit. Mostly I was actually adding specific probes into the law portion of my questionnaire. Because I found that when I was asking consultants about, their opinions on the law or how it's impacting them, they were almost exclusively just talking about the ban on commercial surrogacy, so the ban on paying surrogates. They, on their own, weren't raising the ban on paid intermediaries. So I had to keep probing them for that. So here's where I am now. So data collection phase was closed in February of 2022. I transcribed all my transcripts. I got like 160 pages. I coded throughout February and March of 2022. And I was using both deductive and inductive coding. So I was coming up with some codes that were based off of my interview questions. And then as I was going through, new codes were generated just from the themes that were emerging from my data. Then I went on a nice long maternity leave, and then now I'm back. So currently in the data analysis phase, and what I'm doing is I'm using thematic content analysis to identify themes. So really summarizing significant similarities and also pointing out significant variations. So I am still in the writing phase, in the analysis phase. So what I'm going to share to you today is just sort of a broad overview of some of the main themes that I am seeing coming up over and over again. And I'll share a couple of quotes that sort of demonstrate how these are sounding within my interviews. So the first quote on the slide there, one consultant said, "I think right now agencies are just skirting around the wording of the law in order to operate." And so I'm seeing this really frequently in my interviews, and I'm sort of classifying this as my participants are trying to structure their practices around their understanding of the law. So in other words, they believe that the law prohibits one certain thing, and usually that one certain thing is paid matching. So they're saying, okay, I can't be paid to match. But how can I structure my practices so that I'm not technically getting paid to match, but I can still operate this business? And there were really two main ways that I was seeing that happening. The first is how they're structuring their payment. So some of them are only receiving payment after the match is made. And so they're saying, hey, I'm not being paid to match because I'm only paid once the match is actually made. The other thing that they're doing is they're characterizing their fees as being for something other than matching. So they're saying, yeah, we do matching, but that's not what we're paid for. We're paid for coordination, or we're paid for support. So basically, they're really trying to justify why, based on their understanding of the law, they are still in a legal space. And for the most part, they all felt safe in the legality of their activity. The second quote with the second theme, another consultant said, "Nobody wants to work in a gray zone. Hairstylists have a license, taxi drivers have a license. I'm helping people have babies and I don't have anything, right? You're just in a gray zone." So this ties into the bigger theme that I'm seeing of wanting regulation. So half of my participants said that they wanted consultancies to be regulated. So they wanted to have licenses, or they wanted to make sure that all of the agencies were being held to the same standards. They did generally say that they wanted to be compliant with the law. And, you know, like I said, most of them felt that they were, but a couple of them said that they felt like they were in this gray space. And those of them who did say that they were in a gray space said that they didn't like that. They didn't like the lack of clarity. They didn't like that it felt gray, and that some of them were worried about how much they could expand or what they could do. And so again, this is really interesting when you're talking about the other research that we're hearing coming from Steph and Vanessa, which is also speaking, I think, towards this idea of regulating the agencies. So from my research, some of these consultancies would seem to be on board with that. And then the final quote that I have there, another consultant said, "It's really just about checking in to ensure that anything the surrogate may need is provided throughout the process, and that the intended parents understand that taking care of the surrogate is taking care of their baby." And so this quote highlights the theme of what I'm calling my participants aligning themselves with the surrogates. So throughout my research and my interviews, my participants were more frequently describing how their work helped surrogates or how their work protected surrogates, more so than they were saying this for the intended parents. So as one example of that, you know, when they were talking about coming up with the surrogacy agreement, the contract portion, they all discussed how they would help the surrogate through that and, you know, sort of maybe advice they would give or stuff like that. But very few of them talked about how they would help intended parents or what they would recommend for intended parents. I also found that they were way more likely to assess situations from a surrogate's perspective. So, you know, they'd be talking about something and they'd say, you know, this must be really hard for the surrogate, or we try to do this so that the surrogate feels this way, or we've structured this because we want the surrogate to feel X, Y, Z. And they were, again, doing this more so than they were doing this for the intended parents. And on the one hand, this theme of aligning themselves with surrogates is great because it shows that they do want to help the surrogate. They do have the surrogate in mind. And it is really interesting, I think, too, because initially when lawmakers were putting these laws into place, they were really concerned about the fact that intended parents were the one paying the intermediaries. And they thought that that inevitably meant that the consultants would be siding with the intended parents. And that's really not what I'm seeing in my research. My research is showing quite the opposite of that. And so while it's great that they are in the intended, in the surrogate's corner here, The downside of it is that I did find that this could open intended parents up to some additional vulnerability, right? The intended parents also need someone there looking out for them. And some of my consultants did talk about how their consultancies had specific employees dedicated to supporting the intended parents or being on the intended parent side, or like, being specifically for the intended parents. And I thought that this was really important. And it's possible that my data might have looked a little bit different had I been speaking to, the employees who were specifically on the intended parent side of things. Only one of my participants did say that they're mostly in charge of the intended parent side of things. And that one participant did indeed raise the intended parent's perspective a lot more. So again, it could just be based off of my sample size that I'm seeing this, but I was definitely seeing it come out. And again, having that designated intended parent support person, I think, is really important, because without them, it might be hard for my participants to neutrally navigate conflicts that might arise between the surrogates and the intended parents. So those are the three big themes that are coming out of my research. And, these consultancies, they do get a lot of hate in the media and the press and all of that. And I just want to say that based off of my data, I do see a lot of variation in what these consultancies are doing, what they're saying, how they are approaching this. And so what I want to make sure that I stress is that the point of my project is not to make an unconditional statement that all consultancies are good or all consultancies are bad. I really don't think that that's useful or accurate. Rather, what I'm really hoping that comes out of this is that, there are specific practices that maybe deserve some attention via regulation, and hoping to support evidence-based law reform. And so then quickly with my last minute, I'll just touch on the limitations of my research. So as with all empirical research, there are some limitations. Here specifically, I'm encountering a lot of social desirability bias, which is the tendency to underreport some behaviors that you think are undesirable and overreport others that you think are desirable. And, so this might result in some of them saying, like, hey, here are all the good things I do, and not really focusing on some of the more problematic aspects of their practice. But another theme that I saw coming out, and something that I think helps mitigate this in part of my research, is what I call this other agency rhetoric, where, they're not saying that I'm doing anything bad, but they'll say, but other agencies do bad things. So they'll say, other agencies do X, Y, Z, get paid for matching, approach surrogates too soon after birth, what have you. And so this theme of the other agency rhetoric does help me get slightly a less polished understanding of the Canadian consultancies. And obviously I can't use this the same way that I would use firsthand information. But it is really interesting and relevant to hear, what do these consultants believe is happening in their own field. And of course, my participants were all voluntary. So that could change the nature of who's participating. So now I'm writing up, and I'm hoping to get some defending done and some publications done. So hopefully you'll see some data.
Thank you so much, ladies, for the information you provide. And I find that, in my observation quickly, is there's an overarching observation here with the information that you provided us. There's a lot of information about the agencies, and what we see is the vulnerability that is associated to intended parents and to the surrogates. And there isn't a lot of regulation, and there isn't a lot of rules around protecting IPs or surrogates. And most of the things that we have heard are related to how the agencies are working. So the first question I will ask all of you, and I will open it up to questions from the audience in a few minutes. But what changes to the laws and regulation that are more pressing, in your opinion, and how you envision long-term reform that would address some of the challenges that you mentioned and some of the challenges that I'm mentioning? So who wants to start?
Yeah. Okay, so yeah, I think there's a few different ways forward, some that are more potentially desirable than others. And so the piece that I wrote on the agencies, I concluded by saying, some might say that maybe the first approach we should take is just actually crack down on the agencies, right? And I don't think that that is the best approach going forward, because as is pointed out, I think that these agencies can serve a helpful function, especially if they are regulated in some way. They are helping a lot of people potentially build their families. Another way forward is potentially decriminalizing, which I think also in itself, without any regulation, could cause some problems. And in part, that has to do with, I think this has come up a few times with the conference, federalism, and in terms of the division of powers, it will fall to the provinces potentially to regulate these agencies. And so if we decriminalize at the federal level and we don't have kind of the provinces actually stepping in to regulate, we're going to end up with a vacuum. And so what I'm proposing is actually to amend the federal law, kind of carve out an exception to the criminal prohibitions on these agencies to say these agencies are not allowed to operate unless they are regulated or licensed by the provinces. And I think that that's one way to potentially put some pressure on the provinces to actually step in, or potentially have stakeholders encourage the provinces to regulate in this area. Because I do think we need, further regulation over the agency's fees. I think we can create standardized matching and screening processes. And another potential way forward is to actually make these agencies operate in a non-for-profit way as nonprofits. So that they're not kind of being encouraged by their financial incentives, which I think they very much are now, in terms of how they operate their practices.
Agree with many of those suggestions. Excuse me. So, and I'm just going to pick up on that last point that Stefanie made about, could we think about another model for agencies? So whether we require them to be nonprofit agencies, could we look to other jurisdictions like the UK? And I think we might hear some of this from Kirsty this afternoon, where agencies are regulated. There are different types of entities, and they're much more carefully overseen by either the federal or provincial governments, depending on this federalism discussion. I think from my perspective, I think there needs to be, so there is very little to no enforcement of the Assisted Human Reproduction Act, and that leads to a lot of the uncertainty that we've been talking about this morning. And so, having Health Canada take a more robust role, I think would be very helpful. And I do think it's important that we have other types of mechanisms for intended parents or surrogates to be able to raise their concerns about what's going on with agencies or other practices in this space. So having an ombudsperson who could, consider those kinds of concerns that are being raised by these individuals, or again, having Health Canada play a more active role, I think would be really helpful. As you can probably tell, we could talk about these solutions all day. So I'm going to stop here and I'll pass it to Isabel.
En fait, comme vous savez, nous au Québec, on aime faire les choses différemment qu'au reste du Canada. Donc, on n'avait pas d'encadrement de la GPA avant tout dernièrement, l'an passé. Et ce qu'on constate, c'est que si au Québec, l'application des lois concernant les éléments remboursables sont les mêmes que ceux de santé, ceux qui sont permis par la loi fédérale, c'est les mêmes règlements qui sont utilisés. Il reste qui sont prescrits de façon beaucoup plus stricte. Avec des reçus, doivent être prévus à l'avance, doivent aussi être justifiés. Donc, par exemple, on ne pourrait pas demander des remboursements pour quelque chose qu'on ferait nous-mêmes si on était enceinte pour soi. Donc, ça fait en sorte que les coûts, par exemple, sont beaucoup plus encadrés, beaucoup plus régulés, sont mis en fidéicommis chez un notaire. Et ce qui fait en sorte que plusieurs femmes porteuses qui ont été femmes porteuses avant et qui passent par les organismes ontariens, par les agences, par exemple, se montrent insatisfaites parce que nous disent, par exemple, j'ai droit à me faire rembourser 3 000 $ par mois, puis les agences me disent, trouve des reçus pour 3 000 $, j'ai droit à ça. Alors que là, au Québec, on dit, mais non, tu n'as pas le droit à ça. En fait, on rembourse les dépenses qui devraient te coûter. Donc, il y a plusieurs d'entre elles qui témoignent d'une certaine insatisfaction et qui sont parties pour avoir de faire des projets de GPA en Ontario avec les agences avec qui elles étaient préalablement, exprès pour pouvoir recouvrir là, ces montants-là auxquels elles estiment avoir droit. Donc, ça crée un peu une espèce de disparité, si on veut, sur cet effet-là, ce qui est aussi un autre enjeu parce que si les gens ont mal estimé le coût, ben, c'est tant pis pour la femme porteuse. Par exemple, si on a mal estimé le fait qu'elle avait une compensation de son salaire si elle est alitée, si on ne l'avait pas estimé, on ne peut pas le donner. Donc, si elle n'avait pas prévu à l'avance que ça risque d'arriver, le montant, bon, pour l'instant, il semble être refusé. Donc, ça crée d'autres types de disparités, d'insatisfaction. Mais je pense que cette façon de faire-là est beaucoup plus transparente. Et comme les notaires répondent de leur ordre professionnel, ils sont plus prompts à demander des reçus précis aussi pour les dépenses.
I don't have too much to add because I think Steph and Vanessa hit a lot of that on the head for what I would have said. But the last thing that I'll add is the tough nut that I'm trying to crack when I'm writing my own recommendations in my PhD is sort of like, what do we do about this federalism question? And you know, if we leave it up to the provinces to regulate these agencies, I mean, in this area, the provinces have historically been quite slow and loath to step in. So you know, I'm trying to figure out, is there a way that, you know, the federal government through their criminal law power could still kind of keep a hook in it, you know, by having, you know, similar to what Steph said, except for having Health Canada draft those regulations for the agencies. And I'm not sure how that would fly. I mean, I think the reference about the Assisted Human Reproduction Act told us that it probably wouldn't fly, but you know, so that's mostly what I'm thinking about.
Thank you. And I would just like to go back to one thing that Vanessa said about having maybe more robust role for Health Canada. And it's just an observation, maybe a question also. The fact that parents are, or intended parents are reluctant to even put up a complaint brings the situation where Health Canada don't necessarily need to intervene or check anything because there are no complaints. But parents, I guess, intended parents are afraid to bring a complaint forward because they could be prosecuted thinking that they've done something wrong. So if you have a comment on this or...
Yeah, I absolutely think that that's a legitimate concern, that there may be a perception that there could be some criminal liability attached if they raise these concerns with Health Canada. I do think, however, and I can't say this for sure, I do think that we know enough about what's going on that Health Canada doesn't necessarily need an individual complaint at this stage to, you know, be more keen and more active in this regulatory space. So, and Stefanie might have more to share in terms of the intended parents' perspectives, but I do think we know enough now that Health Canada shouldn't be sitting on its hands and not regulating more carefully here.
Yeah, and I think one of the things I heard from my intended parents, I don't think that it was so much that many of them were afraid to complain because they were worried about their potential criminal liability. There was like a couple participants that indicate they were worried about the law, but actually many of them felt we didn't really do anything wrong. They're worried about complaining because if they do and they want to have potentially another baby through surrogacy, then they're in trouble because they're worried that the news is going to get out that they complained. And in fact, I had heard a little bit about some intended parents, you know, potentially getting money back from their agency if things did not go well. So if they didn't get a match, sometimes they would say to the agency, I want the money back. And then they would actually have them sign an NDA so they couldn't talk about their experience also. So there's a lot of that kind of happening behind the scenes as well.
So the agencies are protecting themselves. I will go to the floor unless you have comments, ladies. No, Madame?
I'm Catherine Pearson. I'm a Fulbright Fellow visiting in Canada right now. And anybody who would like to find out about that program, I'm finding out that not very many people understand it. I'm happy to talk to you. And I'm particularly pleased because I'm at the Center for Health Law Policy and Ethics and working with Vanessa and her team. But one of the things I'm thinking about is this notion of creativity. I'm so impressed by all the people that are in the room that are not just lawyers. And yet we're coming back to law as the default solution. What I'm wondering is, particularly for you, Allie, is perhaps one of the early phases of, oversight is from the industry itself. Can it adopt a set of best practices, perhaps even with your help from what you're researching, and put the burden on them? Standardize what you think are the best practices. That would also give the potential for somebody who's making a complaint to have grounds to make a statement about what they're concerned about to regulators or provincial regulators, et cetera. So just thinking about that as a intermediate step, it's also faster. and the surrogate agencies are probably motivated to do something so that they're not regulated by government itself. Just an idea.
And so one thing that I'll respond to that is I do think that it's a good idea, but I also have heard as part of my data, one of the big themes that came out of it is that these consultants really do not like each other and they do not want to work together. And so what's been happening is, it started off many years ago that there was really only one or two big agencies. And then people are breaking off from those big agencies saying, I don't like what they're doing. I'm going to go do my own thing. And then, people break off from those. And so there's a lot of tension, and they all spoke about a lot of drama in the industry and not wanting to cooperate and not liking what other people are doing. And that's where I'm getting that other agency rhetoric from. So I think to sort of galvanize them and unionize them, I don't know that it would be practically feasible. Yeah.
I think I might just chime in though and say you might lean on other folks who work in this field to say this might be a good idea, right? So, the lawyers, for example, or the clinics, the hospital, there might be other mechanisms to try and lead to those kinds of reforms that Catherine was suggesting.
Great, thanks. And I think I was a little bit on the lines too of just thinking about, but I was just as curious of what's happening with the Facebook groups. I'm wondering as much people's experiences, because of course it's the idea that there are alternatives and what are they finding and choosing different ones. But I'm going to be a lawyer who's also going to be creative. So I'm really curious because it's a common theme that keeps coming up of federal criminal and provincial health regulation. And so I was thinking, it's true of so many areas right now in health. In MAID, right? We're having this question, especially as the feds are moving to deregulate, and there's potential provinces who are seeking to make more restrictive what the federal government might allow with respect to MAID. I was also thinking of regulation in relation to cannabis, because that was very interesting in the sense that, okay, the feds decriminalized, but then each of the provinces adopted very different models for the availability. And so I was doing a parallel thinking here, all right, if you have not the liquor control commissions doing liquor, but instead surrogacy, what does that look like? Or, some of the provinces went to allowing for retail, right? Regulating, but retail outlets. And so I was thinking of those different models, in the surrogacy context.
I'll answer it. I will tell you, and it's maybe biased, but it's from a woman's perspective. Anything that is related to women, often, and women's health, is often neglected by regulators. They do not like to talk about women's issues. And I find that when we're looking at surrogacy, it is often looked upon as a women's issue more than intended parents' issue. So, and that's one perspective. Marie-Pierre, my director of parliamentary affairs, might have another idea on that, and so, and Yasmin also. But I will say that, and as opposed to cannabis, where it doesn't touch an individual, but a lot of people. The other thing is when we're looking at regulation between federal and provincial, you are quite right to say that there are differences. What the federal legislation will do is provide the playground or the framework within which provinces can work, and they can become more restrictive. They cannot be they cannot go over what the federal legislation will provide, but they will have a framework within which they can work. So that's the perspective I would have from a legislator, especially working where federal and provincials are. And again, with women issues, these are not things they want to talk about. And no government wants to talk about reproductive issues, nor regulating surrogacy. So they'd rather put their head in the sand and let the system do whatever they want, and see at some point who's going to be willing to talk about this. But I know that I've been trying for 5 years just to get a study going within a committee from the Senate, and it's extremely difficult. No one wants to look at this, and it's disheartening. But have anything else to?
That's sad. I guess the only other thing, so Joanna, you came up with the 2 examples of made in cannabis. So I was just having a conversation with another colleague who brought up those exact 2 examples in relation to this. And I guess the only response that I would have, so one of the concerns I have about provincial regulation in this area as well is, of course, as we're already seeing very much in this area, is form shopping, right? If we're going to have different responses and some are going to be more restrictive, the agencies are just going to go where it is less restrictive, of course. And especially because it's really interesting with these agencies, they're really operating online. People are contacting them from all across the country. It's not like you have to be in Ontario to work with an Ontario agency. And so my hope is that if this is provincially regulated, that there is some kind of consistency across the country, hopefully. Yeah.
Madame?
Thank you. So Alicia, I really appreciate how carefully you were talking about the language that you're using and sort of thinking intentionally about the things we hear from interviewees and whether or not that becomes sort of a category of our analysis. So it's sort of with that in mind that I wanted to ask this question about the use of the term journey, which showed up on this panel. And then I also, see it in the literature all the time. And I think it's interesting that that metaphor has sort of come to dominate discussions of surrogacy in a way that we don't talk about abortion journeys, or like sometimes we talk about birth journeys, but it doesn't show up in other sort of realms of reproductive scholarship. And I just wanted to call attention to it and ask if that metaphor is sort of shaping the ways that people analyze what's going on with surrogacy. And here I'm thinking about, scholars of science and technology who, like Evelyn Fox Keller, who has talked about the ways that metaphor shapes scientific knowledge making, right? So like the gene as a code of life, or the heart as a pump, right? So they sort of almost seem mundane, but they actually shape the kinds of research questions that get asked. And I worry that with a word like journey, it sort of puts a shape on what the experience or the process of surrogacy is. Like journeys have beginnings, middles, and ends. They're like sort of a coherent path, right? And I think if we said, what are surrogacy experiences or what are surrogacy processes, it might be a little bit more open-ended than saying like, what's the journey? So I just want to, I don't even know if there's a question mark at the end of that, but maybe have you reflect on whether or not thinking about these things as journeys, which I know is language that surrogates use and the agencies use. So I know it's coming from the ground, but I also want to caution us against just accepting it without thinking about it.
Any comment?
It's funny because when I think about journey, I actually think about it with a slightly different connotation. I see the journey as being kind of this thing that goes all the way, all around. It is potentially just frustrated at different points. Like I see it as maybe they're using the language of journey to represent that this is often kind of an arduous process, but maybe not, right? And it is really, that's a great question. I think it really is interesting how that language of journey, especially in the last couple of years, has really started to dominate. And it's definitely, I think, being informed by industry, kind of putting forward that language, at least from my perception of it. But yeah, I don't know whether, it's like process sounds more, I don't know, like formal or more data driven, or like, so I'm not sure where that language came from or really why, how it evolved. That's fascinating. Yeah.
Yeah, I think those are really, it's a really insightful comment, Renee. So it's funny, when we talk about our survey, we talk about experiences. And similarly with the interview, we're thinking about experiences. but the narrative, certainly from the interviews, the surrogates describe in their own terms that they are on this journey. And it's really interesting. It will be really interesting as we're coding this data to explore how and when that term is used and why. So, yeah, thank you for that really great point.
Thank you so much. And leveraging the word journey, so I'm going to ask the question about if this is if it's understood as a journey, then has there any been research or perspectives on women's experiences with negative pregnancy experiences or spontaneous abortions during the process of surrogacy? Have you come across anybody in the panel, or is there any knowledge out there on that? Spontaneous abortions and during the process of pregnancy?
So Isabel might have some, yeah, you go ahead. So I will just say before Isabel goes, this is something that we're looking at in the data from the interviews, but too early to really provide any coherent comments on that. But I know this is something that Isabel has done some work on.
Pour les questions d'avortement, c'est sûr que plusieurs d'entre elles ont dans le contrat qu'elles doivent aller sur une procédure d'avortement si les parents le demandent, par exemple, nonobstant ce qu'elles en pensent elles-mêmes. Ça, c'est une question qui est intéressante parce que, bon, on l'a vu hier, là, la question de l'avortement ici au Canada, on ne pourrait pas forcer techniquement une personne. Pour la question de tout ce qui est stillbirth, fausse couche, morti-naissance, c'est un enjeu qu'une de mes étudiantes de doctorat documente et c'est très difficile pour elle parce que quand elle rencontre ça, des fausses couches, des morti-naissances, lorsqu'elles sont enceintes de 25, 30, 35 semaines, par exemple, et que le bébé est mort à la naissance, elles vivent beaucoup de peine, de déception, de l'impression que leur corps les a laissés tomber, trahis, alors qu'elles se perçoivent comme des femmes très fertiles, capables de tomber enceintes comme ça. Et conséquemment, elles vivent ça difficilement. Mais les parents disent, ben, c'est pas ton enfant, tu devrais pas pleurer, ça devrait pas te déranger. Donc, il y a comme une espèce de malaise, de difficulté. Et c'est la même chose quand elles ont de la difficulté à tomber enceinte. Elles disent souvent, moi, je regardais mon mari, je tombe enceinte. Donc là, c'est sûr que pour toi, je vais tomber enceinte rapidement. Ça prend 2, 3, 6 mois. Là, elles se perçoivent comme infertiles, alors que dans les faits, elles ne le sont pas nécessairement. Donc, c'est un enjeu qui est vraiment difficile parce qu'elles sont prises entre leurs propres émotions puis ceux du parent, puis on ne leur laisse pas cet espace-là pour avoir cette peine-là, en fait.
Merci beaucoup.
Not sure I have a question, but it's an observation. And Senator Moncian, your observation about women's issues always seeming to take a back seat, and that is one of my observations as well. I'm Craig Phillips. I'm a professor in the School of Nursing here. Also a member of the Center for Health Law Policy and Ethics. My work centers a lot about sex and gender minority issues and challenges, which are also very much relegated to some other nether spaces. And yesterday, and I realize you were not here yesterday, we were talking and Professor Almeling touched on some of the male issues and concerns and with regards to reproductive health. I think a lot of it really has to do with power and those power dynamics. And that's some of the stuff that all of us, I think, really need to reflect on and think about. How do we actually strive towards an anti-colonial approach where we can actually start to break down some of those barriers? I do a lot of work on both sides of the US and Canadian border and hear a lot of the rhetoric that comes from other guys who look a lot like I do. And I think we need to remind folks how difficult and challenging it really is to continue to oppress others. And so I just want to leave that there and would love to hear other folks' thoughts, but thank you.
Thank you for your comment. And I think it's, you have to think about all of these things. And thank you.
Hello, thank you very much for your presentations. I was wondering for all of you, how do you feel surrogates should be compensated? both monetarily, their mental health and all. I'm very curious because I've done a bit of research about it and I'm like, what is this in Canada right now? So it's very informative. Thank you.
Sure, I'll start. Sure, I'll start. So I'll start with the caveat that I think some of my other researchers who work in this field may agree with me on, is that my primary concern is actually about the health and safety of people who are acting as surrogates. And I think we spend a lot of time being very concerned about payment and spend not enough time thinking about how we can ensure that law and policy regulates this space to ensure that these practices are safe and positive experiences for everyone involved. So that would be my sort of pitch. I know I find that whenever I talk about surrogacy, the first question that people ask me, should they be paid? Should we continue for this to be altruistic? And I think there's a lot of nuances around that question. It is a question that we have asked in the interviews. And so I think what I'd like to do is actually answer from the perspective of the participants and the people that we've spoken to. And as I've said, the data collection is it's very much in its early phase, but I kind of give you like a sneak peek at the sort of trends that we're seeing from those interviews. The responses were quite varied when we asked our participants whether or not they felt they should be paid over and above the reimbursements for their expenses. But I would say a majority of the people that we spoke to were very supportive of an altruistic system, and were quite concerned that if in Canada we moved to a system where there was some sort of compensation or payment, that would change the experience of surrogacy. And that, as Renee said, the surrogacy journey, a lot of them spoke about that surrogacy journey. For the participants who indicated that that were sort of weighed more in favor of the reimbursement process being sort of loosened up, I say what they were concerned about is, could they receive a gift from their intended parent, from the intended parents? Could there be a less onerous way of setting up the reimbursement system? It's quite onerous. The surrogate needs to keep their receipts. And as we've heard this process described on this panel, the intended parents can only reimburse for that an expense that's receipted, and our participants find that process quite onerous. So, tweaking those kinds of processes, I would say maybe one or two participants indicated that they felt like we should move to a full sort of commercial system in Canada. So, that's just a bit of a mixed bag from what we heard. There certainly wasn't this resounding feeling that we should
May I add something?
Shift away from the current system. And I'm sure there are others on the panel who have heard other
The
things.
surrogates told us that it won't be, if they are being paid, they won't do that for the good reasons. A lot
Yeah.
of them told
Yes.
us. But they noticed that everybody around are being paid,
Yes.
except them.
Yeah, so I'll add to this as well. So the second piece that I'm writing now out of the study with intended parents is exactly on their views of the criminal law. Okay, so I asked them, what do you think? Okay, should we change the law, okay, to allow surrogates to be paid? And again, it was really quite mixed. So a lot of them said, I'd like for my surrogate to potentially be paid more than she is now. Okay, actually, many of them, this aligns with Isabel's last comment, said, we're paying so much money to the agency. We're paying so much money to the clinic. Okay, we're paying so much money to everyone else. Take some of that money and give it to the surrogate. She's the one who's doing all the work. She's the one who should be getting that money. Okay, so I heard that quite a bit. And many of them also wanted, as Vanessa pointed out, really just wanted to give their surrogates gifts without worrying that that was going to come back to them. Okay, they said, I don't understand. I can buy a gift for my friend, but I can't buy a gift for my surrogate. Like, this is ridiculous. And many of them also pointed out that they felt that the HRA is currently, ineffective, inappropriate. They didn't like the criminal prohibitions. They also pointed out what I just noted in relation to the agencies that, surrogates are, some of them being paid indirectly despite not actually being allowed to. But again, maybe that amount should be higher for them. Maybe it should just be legal to allow for that. But, okay, this is the big caveat, many of them were also very concerned about moving towards just decriminalization with no regulation. Really, really concerned about this. They were worried, they disagreed about how this would affect access for intended parents. So often the argument is made that if we allow for payment, there's going to be more surrogates who will do this, and more intended parents will be able to access this. And they said, okay, maybe, although we don't really know that, I'm not sure that that evidence is actually borne out from the study with the surrogates, that many of them are doing this for many reasons that are not financial. And I think there's many of us who you couldn't pay us enough money to possibly act as a surrogate. And so many of them were saying, well, okay, if you increase the cost now, so if it stays the same amount for the agencies, the clinics, the lawyers, everyone, and now a surrogate can command whatever amount she wants, I can't build my family. There's no chance that I'll be able to work with a surrogate. So they said those access arguments get really thrown out the window when you start thinking about that. And this also aligns with what Isabel was saying, there was a lot of language about surrogates' motivations and surrogates doing this for the good reasons, the bad reasons, okay? And surrogates, a bad reason would be a surrogates doing this for financial reasons. They're worried that some surrogates might decide to engage in surrogacy for the money, if the money is high enough. They worried about how that would impact, in particular, relationships between surrogates and intended parents, and how much care the surrogate also gives during the pregnancy. So how she cares for herself in that instance. And so again, the take-home message from that was, if we move towards decriminalization, we really need regulation in this area, according to the intended parents I spoke with.
And if
And
I
I'll
can,
just add,
sorry, go
sorry.
ahead. No, no.
I'll just add quickly from my research, what I heard from the consultants. I didn't actually ask them if they thought it should be commercial or altruistic, but they all really wanted to talk about it. So most of the time, they were very, very passionate about the fact that they still wanted an altruistic model. And for those of them who did say they would want something that wasn't the altruistic model we have now, they were mostly saying we want to get rid of receipts, or it'd be nice if they could just get a flat fee. But even they were always drawing these comparisons to the US, saying, I don't think we should have a free market approach. I don't think that'll be good for anyone.